And I had finished some classes, and they're on the second story of a building, and was coming down this major staircase and took a header. I lost the second two steps, came down, did a perfect 10 out of 10 landing, but then my body came down after me, and I ruptured all the muscles in my thighs and my patella tendons in both legs. And so called the paramedics and was taken over to Marion, where I ultimately had surgery on both legs. And then following my 1 week at Marion, I was transferred by my request to AG Rehab, where I spent the next 10 days. So that's how I didn't get here professionally. I got here semi-professionally, if you'll allow me to say that. So, did I have my own patient room? No. And that's interesting because at Marion, I was in a private room, which had tremendous positives associated with it, particularly since I was in bed so much of the time. But in the rehab, I moved in with a roommate. Beds are separated by a curtain, thin, flimsy, lets the light through, and certainly lets the sound through curtain. I had long leg splints on. My injury required that my legs be straight for 2 months without bending. So I had to lay in bed with splints on, try to get out of bed with splints on, and go to the bathroom with splints on. So going to the bathroom in a non-private room in bed and having the nurses clean your butt is quite an experience, and I do not recommend it. The difference is how you feel not only about your care as a patient, but how you feel about yourself. No privacy. Can't get privacy. The other teammate, you're behind the curtain, is getting therapies. People are in and out of his room, his section of his room, talking to him, no matter what my particular status was. Nurse, I went to the bathroom, or I have to go move my bowels, and can you bring me a bedpan? Sure. How are you today, John? The coming together of those two things emotionally is a very difficult thing to deal with. My roommate left, and there wasn't another patient to fill that bed for a couple of days. So I really had a different experience, the private room experience. And it makes a difference. Those rooms are big enough for a private room with some furniture changing around. I can see it. That would be like the Taj Mahal of patient care. Have your own bathroom, you have the window, and you have the privacy. That really is the essential elements of a caring environment, I think. I would ask all of us to think about what we do when we support a hospital and what that means. To me, as a patient and as someone who was in the hospital system here for 30 plus years, it means that we can take better care of patients. And for patients, it means that they get really better care, because the feeling that you have is so much different. And those 2 days that I was in rehab as a private patient versus the days that I spent time with my wonderful roommate, very different of how I felt. And again, the only way that this happens is through the community support. So once you got your hands on your wallets, understand that we're talking about the Excellence Campaign here. The Excellence Campaign is very focused on private rooms. And as I've hopefully convinced you, it makes a big difference.